this afternoon, there is confusion and chaos at another federal agency vital to the well-being of all Americans from coast to coast, because right now we are monitoring what is essentially a stare down between Donald Trump and the person he picked and put in charge of the Centers for Disease Control and Prevention just a couple months ago. Her name is Dr. Susan Minares, who last night revealed that she is refusing to resign. She's under pressure to resign from the nation's top health official. That's Robert F. Kennedy Jr. He is the Health and Human Services Secretary. Lawyers for Minares provided the backstory. Quote, when Minares refused to rubber stamp unscientific, reckless directives and fired dedicated health experts, she chose protecting the public over serving a political agenda. For that, she has been targeted. This is not about one official. It is about the systematic dismantling of public health institutions, the silencing of experts, and the dangerous politicization of science. The attack on Dr. Minares is a warning to every American. Our evidence-based systems are being undermined from within. Science and integrity can never be compromised. Dr. Minares stood up for both, and she will continue to do so. Kennedy has tried firing her, and the White House tried firing her as well. But lawyers for Minares suggest that because her position, the position of CDC director, now requires Senate approval, Minares actually serves at the pleasure of the president himself, and therefore she needs to be fired personally by him, which is a little awkward. In March, another nominee for CDC director was abruptly withdrawn just prior to his confirmation hearing. At the time, Trump said this about Minares, quote, as an incredible mother and dedicated public servant, Dr. Minares understands the importance of protecting our children, our communities, and our future. Americans have lost confidence in the CDC due to political bias and disastrous mismanagement. The statement was in March. Then 2 months ago, she took part in a Senate confirmation hearing. 1 month ago, she was confirmed. Now it appears she's on the verge of being fired by Donald Trump personally. The big question, though, right now for us is why? What happened between then and now? Perhaps it's worth revisiting that confirmation hearing in June and the answer she provided that appeared to run up against RFK's ideology. Watch.
Do you agree with the American Medical Association that there is no scientific proven link between vaccines and autism?
I have not seen a causal link between vaccines and autism.
Any thoughts about the safety of mRNA vaccine in general?
The FDA has, in the production of the COVID-19 vaccine, had approved the mRNA vaccines as safe and had demonstrated efficacy associated with them.
So you would not be prejudiced from the get-go against such a platform, such a vaccine built upon a platform, whether it's for COVID, flu, for Lyme disease, or anything else?
That is why I have no a priori prejudice against the mRNA platform or any other approach that is being taken to develop vaccines.
Again, we don't yet know exactly why Minares was suddenly targeted by Kennedy. We only know that she insists she made some principled stand in defiance of some directive, and the news of her firing has triggered an exodus of top talent. Following news of her firing, 4 other director-level CDC officials announced that they, too, were resigning. That includes the CDC's top respiratory illness and immunization official, who issued a statement that read in part, quote, I am unable to serve in an environment that treats CDC as a tool to generate policies and materials that do not reflect scientific reality and are designed to hurt rather than improve the public health. Having worked in local and national public health for years, I have never experienced such radical non-transparency, nor have I seen such unskilled manipulation of data to achieve a political end rather than the good of the American people. Wow. Earlier today, Robert F. Kennedy Jr. was asked about this on Fox News.
Is this something that's caught you by surprise? What's your reaction to people that are getting a little worried?
I think that, no, it has not caught us by surprise. Again, I cannot comment on personnel issues, but the agency is in trouble, and we need to fix it, and we are fixing it, and it may be that some people should not be working there anymore.
Including the person who was confirmed a month ago? Earlier today, there was a rally in support of those folks who just resigned in protest outside of the CDC in Atlanta. Whatever truly happened behind the scenes to put in motion all this chaos, it does appear to be another example of another federal agency willfully and intentionally depleted of science and rigor and talent. And as always, it's not RFK Jr., it's us, the American people, who stand to pay the price. It's where we start today with some of our favorite reporters and friends. Former White House COVID-19 response coordinator, Dean of Brown University School of Public Health, Dr. Ashish Shah is back with us. Also joining us, New York Times health policy and politics reporter Cheryl Gay Stolberg is here, and former Deputy National Security Advisor to President Barack Obama, MSNBC contributor Ben Rhodes is here. Dr. Shah, let me first ask you if you have any more information about what happened, what this was about behind the scenes.
Yeah. Well, first of all, Nicole, thanks for having me back. I've talked to a lot of friends at the CDC, including people who have resigned over the last 24 hours. Look, basically what it came down to is RFK Jr. has a whole set of preconceived beliefs that are unmovable by data and evidence. He essentially, on COVID vaccines, came to the director and had presented a set of approaches on restricting access to COVID vaccines. She would not sign off on it. I think for people in the CDC, this was a harbinger of what is coming in September, when the secretary is almost surely going to come out and claim that vaccines cause autism based on, as Dr. Daskalakis said, unskilled manipulation of data. And I think this just became untenable. And Susan Menares is a person of great integrity and courage. And I think she felt like she could no longer continue to sign off on things that are just patently false. And then she was pressured to fire her entire senior team. She didn't do that. And we are where we are.
Let me just make sure I understand all the words that are being used here. Unskilled manipulation of data. What are they warning us about?
Yeah, so look, Secretary Kennedy hired somebody to come in to figure out what's causing autism in like 3 months. First of all, that is not a doable task. There are a lot of things that have contributed to autism. The person who has come in is not particularly sophisticated, is not somebody who has a lot of capability, and they're really doing a very shoddy analysis designed to demonstrate that vaccines cause autism, even though all the evidence and all the analysis so far has proven that link to be false. So it's not just its manipulation of data for falsehoods, it's really being done by an amateur who's not very good at this. And that's the point I think Dr. Daskalakis was making.
And help me understand what this means for the American public and those who rely on vaccines to protect their families and their kids and their ability to go to work, their ability to send their kids to school without worrying about COVID and flu and everything else. Are vaccines themselves in jeopardy?
Yeah, so Nicole, the problem here is that actually much more is at jeopardy than just vaccines. Of course, vaccines are absolutely in the crosshairs, but let's look at what has happened. We've fired a lot of CDC staff over the last 5 months. Now we have fired, or actually en masse resigned, this entire senior leadership of the CDC, not just the director, but the people who run the major centers inside CDC. Essentially now you have a hollow shell of an organization. Obviously, vaccines are one part of what they do. They do suicide prevention. They do chronic disease management. They do disease outbreaks, food outbreaks. When there is a salmonella outbreak, CDC goes. All of that is now at substantial risk. Nobody is minding the store, managing those things. Americans count on that. State public health officials need a functioning CDC. And right now, we do not have a functioning CDC. And I'll be honest, I tend not to be a kind of a doomsayer. I don't see in the short run a path forward to rebuilding a CDC. Secretary Kennedy has boxed us into a corner, and the American people are going to suffer as a result of this.
So if the American people are going to suffer through disease and illness, and that was the thing that really sank Donald Trump's first presidency, if you could say something directly to Donald Trump right now, what would you say?
Well, I actually have said this to people in the Trump White House, and it is exactly this point, which is mismanagement of an infectious disease outbreak sank his presidency, certainly sank his reelection. And this is the one thing you don't want to screw up twice. There are lots of other things that you don't want to screw up, but for me, this is a really, really important thing. And I have colleagues and friends in the Trump administration that I have said that to. They agree with that. The problem is that they have a health secretary who's actively undermining that agenda. And there is, I think, going to be a reckoning between the president and the health secretary, because ultimately, when people get harmed, it will fall on the president. And I don't think the president likes that kind of political liability.
What do you, I mean, RFK Jr. is a crank. He never pretended to be anything else. What do you see as 3.5 years for the entire sort of mass of science and medicine and health professionals that he oversees if Donald Trump leaves him there?
Yeah. Well, first of all, I think many of us are hopeful that he will not be here that long in that role. Second is what is going to happen is you're going to see a lot more action by states. I think I've been talking to state health officials, not just in blue states, but also in purple and red states. They are horrified at what is happening, and they are realizing that the buck is going to have to start stopping with them. And so you're going to see states beef up their processes. They're going to have to invest more money. But a 50-state solution to public health doesn't work. It didn't work in the pandemic. It's not going to be a great solution, but you are going to see states take more of a role. And you're going to see a lot of discoordination across the country. And then on things like NIH and FDA, I mean, I'm hoping that the leaders of those do a better job of standing up and continuing to fight for what's important.